While the COVID-19 pandemic continues to wreak havoc on life in the U.S. as we know it, closures, staff shortages, and stay-at-home orders have greatly impacted those needing to access the healthcare system for non-COVID reasons. This includes those patients prescribed opioids for their chronic pain and those with or who are seeking treatment for opioid use disorder. Patients in underserved communities are often the most affected by disaster. COVID-19 is no exception. COVID-19 meets the opioid epidemic, the perfect storm. According to a recent article published in the American Journal of Managed Care, mounting evidence suggests the incidence of substance use is increasing during the pandemic, and the opioid epidemic is seeing a resurgence. There is a greater likelihood of patients being pushed into unplanned opioid withdrawal as stay-at-home orders cause disruption to all facets of everyday life. According to Bob James, Director of Medical Affairs at US WorldMeds, US WorldMeds recognizes that this may be a time when many patients are thrown into unplanned opioid withdrawal and need help with symptoms which can be devastating, even without the complication of quarantines and social distancing. Symptoms of opioid withdrawal can come on as quickly as 6 hours after stopping the use of opioids and include aches and pains, yawning, stomach cramps, feeling sick, heart pounding, muscular tension, muscle spasms, chills, runny eyes, and insomnia. US WorldMeds, a pharmaceutical company based in Louisville, Kentucky, has been operating in the heart of the opioid epidemic as the developer and manufacturer of Lusimira, lofexidine, an oral medication that treats the symptoms of opioid withdrawal. Lusimira was approved in 2018 for the mitigation of opioid withdrawal symptoms to facilitate abrupt opioid discontinuation in adults. Lusimira is the only non-opioid medication approved by the FDA for the treatment of opioid withdrawal symptoms. Lusimira will not completely prevent the symptoms of opioid withdrawal and is not a treatment for opioid use disorder. See important safety information at the end of this presentation and the full prescribing information. Lee Warren, US WorldMeds Chief Operating Officer, commented, US WorldMeds has been active in addressing the opioid epidemic. As we saw the fallout from this additional COVID-19 global crisis, we wanted to do our part to help out in underserved communities. US WorldMeds reached out to FEMA and their partner, Healthcare Ready, for assistance in connecting them to communities in need. Healthcare Ready is a not-for-profit organization that brings public health organizations together with the private sector to address pressing issues before, during, and after disasters. Sarah Baker, Program Director at Healthcare Ready, stated, Healthcare Ready recognizes the critical role partnerships play in moving donations through the supply chain and into the hands of those who need the most, whether it's PPE or a medication like Lusimira, especially during the coronavirus pandemic. Healthcare Ready connected the dots to VIP Community Services in Bronx, New York, a federally qualified health clinic and certified community behavioral health clinic that offers integrated medical, behavioral health, housing, and wraparound services to improve the health and well-being of the Bronx and surrounding communities. VIP provides badly needed medical support to those suffering with substance use disorders, including opioid abuse and addiction. US WorldMeds agreed to make a donation of Lusimira to VIP worth approximately $500,000. This donation will allow appropriate patients who are facing unplanned withdrawal to have access to the medication at no charge. VIP has seen their community hard hit by COVID-19. According to VIP CEO Devian Fletcher Blake, family nurse practitioner, if ever there was a time for a donation like this, it's now. COVID has highlighted how left behind our patients have been in the pandemic. For us, it's a win-win to receive a donation of Lusimira to help those patients suffering from unplanned withdrawal. In summary, no one could have imagined how the COVID-19 pandemic would impact society and in turn worsen the fallout of other concurrent national crises like the opioid epidemic. These four very different organizations have come together to benefit those left hurting by this terrible convergence. Important safety information. Lusimira can cause serious side effects, including low blood pressure, slow heart rate, and fainting. Watch for symptoms of low blood pressure or heart rate, including dizziness, lightheadedness, or feeling faint at rest, or when quickly standing up. If you experience these symptoms, call your healthcare provider right away and do not take your next dose of Lusimira until you have talked to your healthcare provider. Avoid becoming dehydrated or overheated, and be careful not to stand up too suddenly from lying or sitting, as these may increase your risk of low blood pressure and fainting. When your treatment is complete, you will need to stop taking Lusimira gradually, or your blood pressure could increase. After a period of not using opioid drugs, you can become more sensitive to the effects of opioids if you start using them again. This may increase your risk of overdose and death. Before taking Lusimira, tell your healthcare provider about all your medical conditions, including if you have low blood pressure, slow heart rate, any heart problems, including history of heart attack, or a condition called long QT syndrome, liver or kidney problems, or if you drink alcohol. Tell your healthcare provider if you are pregnant, plan on becoming pregnant, or are breastfeeding. It is not known if Lusimira can harm your unborn baby or whether Lusimira passes into your breast milk. Especially tell your healthcare provider if you take benzodiazepines, barbiturates, tranquilizers, or sleeping pills, as taking these with Lusimira can cause serious side effects. The most common side effects of Lusimira include low blood pressure or symptoms of low blood pressure, such as lightheadedness, slow heart rate, dizziness, sleepiness, and dry mouth. To report suspected adverse reactions or product complaints, contact US WorldMeds at 1-833-Lusimira. You may also report suspected adverse reactions to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Go to lusimira.com for full Lusimira prescribing information.